So I'm seeing a focus on rural veterans in the back when it comes to vaccinations.
Yeah.
Is there going to be an overall focus in their healthcare moving forward?
Yes.
We have Atlas sites for telehealth. Are we going to be opening more of those up? So you said yes. So.
Yes, and this was a big topic in my consultations on the Hill before confirmation. A big part of the confirmation hearing.
Yeah.
Obviously, with the chairman from Montana, ranking member from Kansas, this is a big priority for them, but it's a big priority for me because a lot of our vets are in rural communities, and so you highlighted some of the tools that will continue to expand. This question of telehealth and connectivity is going to be continue to be a central piece of how we provide care, but that's going to require us getting help from other federal agencies. So we got to go to the FCC to make sure that they're helping us with broadband. Okay. USDA, the Department of Agriculture, same thing, helping us with broadband. And then we have to make sure that we're investing. And then this gets to community care. We were talking about that before. Yeah. We have to be a good partner at VA. We have to be a good partner with the community providers who take care of our vets when they're in the community. Sure. So that means paying our bills in a more timely fashion. And
they'll appreciate that.
They will appreciate it. Well, I'll tell you this, they don't appreciate it when we don't.
Absolutely. Absolutely.
But then this gets to the last point, which is we have to have the not just infrastructure, but the people in the rural communities. And so that means really working the network and really working to ensure that we have rural providers who are our partners. So I got a good buddy of mine. So
reaching out into the community to say, hey,
just making sure we've got docs and nurses in rural communities across the country. Sure. Which is this is a major challenge for rural states and rural communities everywhere.
Oh yeah.
And so
I know back home they're talking about shutting down the hospital.
Exactly.
Because there's not enough people coming in.
Exactly right. How do we keep those people there so that we can work with the local community so that we have shared capacity? Yeah. And that'll be a big part of our effort. And that goes back to the first question you asked around community care, which is we have to do both of these things well. We have to do community care well. We have to continue to do care in the system well because we need the whole capability.
And we're just talking about healthcare. Mental health, I'm sure it's even probably less capacity in the community.
Well, that's a challenge everywhere.
Yeah.
Rural, urban, suburban, exurban. We have so much demand for mental health care. Here's the good news in that, which is the stigma is going down and people are recognizing that the mental health care is every bit as needed as your physical health care. So that's great that people are demanding it. But as people are demanding it, we have to make sure that the supply keeps up. And so telehealth ends up being really important to that. But the integrated care offered by the VA system, you can't shake this.